Hi everyone, we're starting out with module number 4 now. So what we're going to do in module number 4, we're going to take a look at chapters number 6 and 12, and you're going to continue to prepare for your upcoming assignment that's due in module number 5. So what we're doing in chapter number 12 is we're really looking at clinical epidemiology. We're looking at things such as screenings, evaluating tests, who will benefit from treatments, risks associated with interventions. So when we're looking at some of those key components, it's really important to understand the reliability and validity of particular tests or test results. So with that, there are differences, and sometimes we use the words inappropriately. So validity, does it really test what it's supposed to be testing? And looking at reliability, is it consistent with the tests? And a test may be reliable, but it may not be accurate. And so there has to be a mix of reliability and validity to actually document that, say, a screening is appropriate to use or to do. So again, this is helping you to really use your critical analysis skills and know exactly what some of these terms are relating to. So again, you can really read and discern the different types of studies as you're looking at applying those in practice. So what you'll be doing in chapter number 6, you'll be looking at some of those indices that impact health. You're going to be looking at factors that you may commonly hear about, such as morbidity and mortality, years of potential life loss, those types of components. And again, we're going to look at each one of those factors, and what you want to do is understand where those numbers come from so that you can read your the studies or whatever research that you're looking at and really know what those terms actually mean, and be able to use, again, that critical eye to analyze what you're seeing. With that, within the module, you have some helpful hints for those kind of complex aspects of epidemiology, but sometimes it's very easy to show in picture-wise. So I've included some very helpful tools to understand attack rates and case fatality rates, and also looking at validity and reliability. So this is a wonderful visual that would probably take an hour to explain if you would just use your words, but looking at the visual, it's very clear as far as differentiating reliability and validity, and knowing that when you're looking at tests or different types of treatments, you want to look at something that's highly valid and highly reliable. So those are the key components. One or the other by itself isn't necessarily the most appropriate. So it's the combination of those two. So take a look at this as well. And incidence and prevalence are very important to understand, and there is a difference. And again, those are some of those terms that are sometimes used interchangeably, but they're really not. So again, this is a very easy way to understand incidence and prevalence, and that will be a component of the discussion board as well. So let's go ahead and take a look at the discussion board. Okay, here we are in our discussion board, and what we're going to be doing is just like before. We're going to be doing either set 1 or set 2. It's your choice, And so the first set involves years of potential life lost and looking at the county health rankings and roadmaps. And again, this will be something that you all will use when you're doing your synthesis. So pay attention to the county health rankings and what your classmates, if you don't choose set number 1, what your classmates include about county health rankings. And then in set 2, you're going to look at crude mortality rates and cause-specific mortality rates. You're going to look at some of the prenatal, postnatal mortality rates as well. So looking at this one, you're also going to dive into the difference between validity and reliability and really tease that out, knowing the differences, and also looking at specificity and sensitivity and why it's important to understand the difference. And again, this is information that you will be taking forward as you look at some of your future assignments. So each component will be critical as you move forward with your work and your coursework. So if you have any questions or concerns, please let me know. Take care now.